Today we will discuss about leptospirosis. Leptospira is a zoonotic disease. Zoonotic disease is a disease that spreads from animals to humans. Leptospirosis is caused by a spirocheta called leptospira. Around 250 serovars of leptospira have been identified which can cause leptospirosis. This leptospira is a coiled motile microorganism. They have flagella on them which gives motility. Coming to the epidemiology, leptospira can be endemic and epidemic in many areas. It is spread worldwide, though it is more commonly found in tropical region. Poor hygienic conditions favor the spread of transmission of leptospirosis. Coming to the gender distribution, men are more commonly affected than women because they work in the fields and they have more outdoor activities than women. The disease spreads mostly in the rainy season and during monsoons. Rodents, especially the rats, act as reservoir of leptospira and they harbor leptospira for a long time. When the secretions like urine, blood, tissue of these reservoir animals come in contact with humans, the disease gets transmitted. Water acts as an important vehicle. As I told you, during monsoon season, when there is floods, the infected material can get transmitted to distant places. The disease can range from asymptomatic infection to a very severe infection which can be fatal. It usually presents as influenza-like illness. Because many patients are asymptomatic, the cases may go unnoticed. Patients, because of their influenza-like illness, may not seek medical help so that we can pick up leptospirosis. Certain occupations are at high risk of leptospirosis, including veterinary vets and people who work in veterinary hospitals and slaughterhouse employees. The disease is more common in suburban areas where the rats are found more. Recreational exposure, that is water skiing, swimming, river rafting in fresh waters, can help in the spread of leptospirosis. Incubation period has been ranges from 2 to 20 days. Maximum incubation period of 30 days have been described in many books. Coming to the pathogenesis, the infected material when comes in contact with cuts, abraded skin, mucous membrane, or from the conjunctiva and oral mucous membrane, they proliferate and they cross the tissue barrier, and through blood homogeneously they spread to disseminate to other organs. Now this phase is called leptospiremic phase. The leptospiremic phase is followed by an immune phase where the body mounts an immune reaction, immune response, where the rise in the antibody titers can be seen, with which correlates with the fall in the leptospira concentration. Coming to the clinical manifestations, as I told you, the disease can be asymptomatic. Then some people can have mild infection where it presents as febrile illness or influenza-like illness. The disease is classically described as biphasic. There are two phases. One is mild phase and followed by a severe infection. Mild infection can present as fever, chills, headache, nausea, vomiting, muscle pain. Muscle pain is very characteristic. Headache in the frontal area and also retroorbital pain can be seen in certain patients, which mimics dengue-like illness. Physical examination is not pathognomonic. Examination one may find tachycardia, tachypnea, then tender lymphadenopathy, tender hepatomegaly, splenomegaly, then lymphadenopathy, crackles in the lung examination can be seen in clinical examination. Mild infection, when it progresses to severe infection rapidly, can have a high mortality rate up to 50%. The triad of hemorrhage, jaundice and acute kidney injury has been described as Wales syndrome. Now, hemorrhage may occur in different organs. When it happens in the lungs, it presents as pulmonary hemorrhage, where the patient develops breathlessness, increase in the respiratory rate, drop in saturation. Gastrointestinal bleeding can manifest as hematemesis, that is vomiting of blood, and also melena, where the patient passes blood stained stools. And urinary tract hemorrhage, that is hematuria, or passing blood in urine. And also skin hemorrhages can present as petechiae, ecchymosis, and bleeding during venipuncture. About 5 to 10% of the population can present with jaundice, which corresponds to rise in the enzyme level in the liver function tests, and acute kidney injury. Elderly population and younger population present with the altered mental status, which might be because of the leptospira meningitis, where the organisms can be isolated in the CSF. Patients who recover from mild to severe leptospirosis can have long-term symptoms in the form of fatigue, myalgia, malaise, depression. So how do we diagnose leptospirosis? Careful history has to be taken. History of travel to the endemic region, then indulging in recreational sports can give a clue to the diagnosis. Coming to the lab investigations, there can be raise in the total leukocyte count. Inflammatory markers like C-reactive protein, procalcitonin, ESR levels may be raised. Platelet count can go down, which presents as hemorrhagic manifestations. When there is pulmonary hemorrhage, chest X-ray may show patchy alveolar infiltration pattern. Polymerase chain reaction can be done, which helps in the diagnosis of the leptospirosis, which is about 5 times more sensitive to the antibody microagglutination test, where the titers of 1:200 to 1:800 aids in the clinical diagnosis. More than the absolute titers, the rise in the titer level from the leptospiremic phase to the convalescent stage aids in the diagnosis. So, before treating, you have to rule out other conditions like dengue, chikungunya, malaria, which present influenza-like illness, which can present with the similar findings. The leptospira is very susceptible to the antibiotics. Mild infections can be treated with the doxycycline, 100 milligram BD, that is twice daily, or amoxicillin, ampicillin, 500 milligram TID per oral. Severe infections, severe wheel syndrome has to be treated with IV preparations like penicillin 1.5 million units IV or IM 6 hourly, ceftriaxone total dose per day 2 grams IV. Now the duration of treatment has to be around 7 days. Usually culture sensitivity is not done because leptospira may take weeks to months for growth. So these empirical antibiotics helps in treating the infection. When there is severe infection, supportive treatment has to be given to decrease the mortality. If the patient presents with AKI, then hemodialysis, peritoneal dialysis has to be initiated with antihyperkalemic measures. If the patient presents with a pulmonary hemorrhage, mechanical ventilation should be instituted to support breathing. Other supportive measures have to be taken care of to decrease the mortality rate. Thank you.